Hey guys, so today I want to talk to you about surgery, the big scary S word. I'm due to have mine on Monday, which, I won't lie, pretty scared about. It's a big, leap in my treatment. I finished chemo, woo, but, that's just one stage out of so many in dealing with cancer. And my surgery decision was epically hard. I had to choose between having a lumpectomy, which is where just the lumps removed, as well as a surrounding area of tissue, and then after your surgery they test the boundaries of the area of skin that was taken, and if that area is clear, then that's a successful operation and you can save your breast. But for me, unfortunately, ultrasound and MRI scans revealed that actually there are other areas of concern around my original tumour site. That is really small, minuscule areas that couldn't really be tested, and so there was a chance that these areas could have been cancerous. Now for me to say, I'll go ahead and have the smaller lumpectomy, that's sort of too much of a risk for me, because if then it figures out later on that, hey, these were little tiny tumours and now we're going to grow and cause, trouble, I just couldn't take that risk. So I decided with my surgery, with my surgeon, that actually it's best to perform the bigger operation, which is the masectomy. What this means is that they will take away all my breast tissue, so effectively remove my right breast, and then in the very same operation they will perform a reconstruction, which is forming a breast for me. It's not going to look perfect, it's not going to be like having a boob job or anything glamorous like that, but what it will do is give me a realistic shape. It will be smaller, it'll be like a B to C cup, so we'll have one double D breast and one C cup for about 6 months, until I'll undergo further surgery to have a reduction to match, but it'll all be worth it in the end. The type of surgery that I'm going to have will be an implant. It will be an expandable implant. What that means is that the implant that's placed under the skin and muscle is slightly deflated, and then there'll be a port underneath the breast, and then this is where the nurse will inject saline every 2 weeks until it reaches a size that I find to be comfortable and acceptable for me. It can then be replaced with a more permanent implant if needs be, but these implants usually last around 10 to 15 years, so they're pretty good. I think I'll be in hospital for about 5 days in recovery, so I've got lots of DVD box sets out already for that. And I think I've already mentioned I'm going to University College London Hospital, where they have a special breast unit there. It's all women. I probably will be the youngest there, but that's life. I am an exceptionally young person to have breast cancer, so go figure. I'm trying to think what else I haven't updated you about, but this is basically going to be a set of videos following my surgery and my recovery. I'll talk to you about how I feel about my new breasts when it's there, and eventually it will all come together and I'll have good boobs at the end of it, and they can do amazing things nowadays with surgery. So I think for me to speak to any women that are diagnosed or that are due to undergo breast surgery for cancer, that you should know that you should have faith in your surgeon, because they can perform some amazing procedures now that look so realistic. And hey, you might even think that your breasts are better afterwards than they were before, and ultimately it's all working towards that goal of saving my life. So we got to keep trooping on. Other than that, I'm feeling good, I'm feeling alright. I have my days where we have to acknowledge the psychological, you know, hard times of what I'm going through. You know, when I feel physically good, sometimes my brain's going a bit crazy. I'm feeling anxious about what I'm going to do with myself each day. I find it hard not working. You know, I was very driven before. I really wanted to make like some crazy good career for myself and be really independent, but you know, I find myself back home. I'm unemployed, I'm fighting cancer right now, so you know, it's a world upside down. But you know, I'm really pleased right now. I'm writing for Fabulous magazine, and if you go on their website, I'm doing a blog for them, and that's a weekly blog, and it follows weekly what I'm up to. So if you want to get a more up-to-date version of what's going on with me, you can check that out. And you know, my ultimate aim is just to raise awareness for younger women, because I don't think we know enough about all this, and hopefully my unfortunate experience can help other women. So that's everything for now, but my next video will be after my surgery. It might be a bit sore, but ultimately, you know, I'll be over the hurdle, so watch out for that. Bye.